Hi everyone, in this series of anatomy quick revision on the topic in head and neck, today we are going to revise the posterior cranial fossa. So the posterior cranial fossa is the most posterior part of the internal of the skull, and its boundaries are marked by the sphenoid bone, the temporal bone, the parietal bone and the occipital bone. So the features it includes are the first clivus, which is a smooth sloping area below the body of the sphenoid. Second is the foramen magnum, which is the largest foramen of the skull, and it is oval in shape that contains the vertebral artery, sympathetic nerve, some ligaments, and medulla oblongata and meninges. So the next feature is the internal occipital crest, which is the crest behind the foramen magnum, the internal occipital protuberance, that is the elevation below the crest, and the cerebellar fossa, which contains the cerebral brain. Then next is the transverse groove. This is for the transverse sinus. Next is the sigmoid groove, which is for the sigmoid sinus. And below it there is internal auditory meatus, through which the vestibulocochlear nerve passes and internal auditory vessels passes. Then is the jugular foramen, which is very important foramen, and it is present below the petrous part of the temporal bone, which contains internal jugular vein and 9, 10th and 11 cranial nerves. Then the hypoglossal canal, through which the hypoglossal nerve passes, and meningeal branch of ascending pharyngeal artery. Then there is posterior condylar canal, through which the emissary vein passes.